This is the review of the non-rebreather mask components. This is the reservoir bag, supplemental oxygen inlet, one-way reservoir valve. There are two one-way exhalation valves, metal nose piece, and securing strap. Under normal operation, the reservoir bag supplies 100% FiO2. So during inhalation, this one-way valve will open, allowing the air to pass into the mask. On exhalation, this valve is closed, allowing the reservoir bag to refill, and then opens the exhalation ports. The non-rebreather part simply means that when the patient exhales, that exhaled air goes out, and when they breathe in, these exhalation valves will close, preventing outside air to pass through, only allowing 100% FiO2 from the bag during ventilation. When placing the non-rebreather mask, first ensure you have enough slack on the securing strap. Place the strap around the patient's head, ensuring that it remains above their ears. Next, you'll pull tension until you can create a seal. Close the metal nose piece, and then inspect around to make sure that there's no gaps. I want to review some concepts and a couple of risks associated with the non-rebreather mask. First, oxygen delivery. Text will say somewhere between 80 or 90% FiO2 is delivered. The problem with this is it's actually further variable. Some text will say as low as 60 and as high as 95. But what I want you to understand here is there's a range, and it's really related to mask seal. So if you have gaps around the mask, of course, it's going to pull outside air and mix and lower the amount of oxygen delivered. Also, a lot of times I'll see an exhalation one-way valve is pulled off, and that will allow for outside air to mix with the 100% FiO2, thus lowering the percentage. So ensuring that the non-breather is complete and that the seal is good is vital to the amount of oxygen percentage being delivered. Next, the flow setting. Again, text will say somewhere between 10 and 15 liters. This is really an educational shortcoming. The reason being is sometimes 10 to 15 is not enough. You'll need greater, 20 or 25 liters. And sometimes it's way more than you need. And so what happens is they're trying to teach it to we'll say the least intelligent person by just giving you a value. So after this video, we'll look at a titration demonstration to really kind of hit home how much is too much or too little. Lastly, risks. There is a situation when you can get insufficient flow, meaning there's not enough oxygen rate on the flow regulator or Christmas tree, and you're deflating the bag and you're actually restricting the amount of volume a patient can get. This essentially will suffocate them and is a huge risk. I'm going to demonstrate titration for the non-rebreather mask for a minimum setting, so currently at 25, and we'll come down so we maintain the reservoir being taut. Patient is breathing normally. So minimum setting right here is at 4 liters. You see the bag is remaining full. It's draining with the inhalation and it's refilling with exhalation. This will demonstrate non-breather at too low of a flow rate. Watch the reservoir bag as it decreases. I want to follow up on the two videos you watched about titration and low flow state. So in general, we're not really going to titrate. Generally speaking, we have enough oxygen, so 15 or higher is totally fine. Other than wasting oxygen, there isn't really too high of a flow rate. On the other hand, if you are titrating and there's a change in patient condition and they start to breathe faster, it's really easy to get into a low flow state and then suffocate them. So just in general, of course, be a critical thinker, realize your resources, what you have on hand, and most of the time just pick a really high rate so you don't have something that you don't have to think about. This concludes the non-breather mask video.